Michael Tildesley, a professor of life sciences, joins us now from the University of Warwick in the UK. Good to have you on the programme. Explain to us why and what is the thinking behind these so-called COVID-19 parties. I've seen some officials believing that people are exposing themselves intentionally as part of a herd immunity strategy. Is that why?
Well, I mean, the first thing I should say is that this kind of strategy is extremely dangerous and could have knock-on health effects. I mean, from an individual's perspective, the reason that people are doing it is because of the belief that they will go and they will get infected, they will gain immunity. And if there is a policy change whereby people who are immune may be able to resume their normal life sooner than others, then that's sort of the rationale behind these people doing it. The danger, of course, with that is what we're trying to do. We're just starting to ease our way out of lockdown in many countries, and there is the real danger of a resurgence on a second wave occurring, which we could see if these people expose themselves in these cases. And some people may be at risk of serious harm, hospitalisation, and possibly very, very serious conditions. So this is something that we would very strongly advise against.
Understandably. Could there be any positives at all from this that we're missing?
It comes from kind of the underlying idea. So it's sort of well known that if you take a childhood disease such as chickenpox, then these kind of chickenpox parties are quite well known, whereby parents will meet up with children, because if children get chickenpox relatively young, then the health risks are pretty low. This is a very different situation. COVID-19, we have, as you've just said on your programme, hundreds of thousands of deaths directly attributable to COVID-19 now. So that is a clear health concern. Of course, the vast majority of people who get infected with the virus will have probably only relatively mild symptoms, but it's important that we look at the bigger picture, not just the individual risk, but let's say if I was fit and healthy and I put myself in that situation, I need to think about whom I might infect if I expose myself, the more high-risk individuals that I could be passing the virus on to. So that's extremely important for us to look at.
Your message, Michael, to anyone thinking of going to a coronavirus party?
I would, as I said, just to re-emphasise, I would strongly advise against this. We are, many countries around the world have got evidence that we are now starting to control the disease, that the reproduction number is below 1, and we can start to think about releasing lockdown measures. But there is a real risk of a second wave occurring if we are irresponsible, and we need to gradually lift measures, monitor, and hopefully keep the virus under control, and think about all of these people who have underlying conditions, the elderly, and from now on we need to protect those people so that we don't get a large second wave occurring.
Michael Tildesley from the University of Warwick, thank you so much.